Our press briefing for this afternoon, the first day of the meeting of the Assembly of the Heads of State and Government of the African Union. Thank you very much, colleagues, for coming. We have a full house. We thank you very much for your interest in the issues to be discussed. And here to discuss those issues with us, we have the Commissioner, Mrs. Amira Elfadii, and she is the Commissioner of Social Affairs, but she also has another additional title, and that is as the Envoy of the Chairperson on the situation of stranded migrants and refugees in Libya. Commissioner this afternoon will talk to us on a number of key issues. She'll give us a brief on the coronavirus and the status of the Africa CDC response to Ebola. She will talk about the African Medicine Agency, the AMA. She'll talk about the 30th anniversary of the African Charter on the Rights of and Welfare of the Child. She'll talk about domestic health financing. And then finally, she'll give us a brief on social protection and social security for African citizens. Commissioner has about 30 minutes to be with us. So we need to make the best use of that time. She'll give us a briefing, after which we will go into a question and answer session, which will really comprise of one question per person. Very strictly, please, one question per person for the first round, so that she can take as many questions as possible. And then thereafter, if there is still time, we can then come to the second round. But Director, Madame Mariama Sise, will be here to continue to take questions. And to her left, we also have Dr. John Nkengasong. He's the director of the Africa CDC, the agency that is dealing with public health issues. All right. So, Commissioner, I hand over to you.
Thank you very much, Winnie, and thank you to the IC for organizing this press conference. And good evening, journalists, representatives of media agencies. As been said, I have...
There's a problem with interpretation. Are we having problems with interpretation? Are you okay? Those of you who need interpretation, you are fine?
It's okay.
All right, okay.
Good evening. We have prepared a document on the issues being presented by Madam Winnie, and we can provide some of hard copies if you want at the end of this press conference, because I would like to touch upon the issues briefly. Maybe later we can go into the details. Dr. John and the Director of Social Affairs can give more details, and also we can provide you with hard copies. Social Affairs Department, as you know, has a very wide mandate. We have 6 divisions, and we have 4 technical institutions. The last technical institution that being established is Africa CDC, Africa Center for Disease Control and Prevention. It was launched in January 2017. And from that day till today, we can say that we have a technical institution who is fully functioning, who has the ability to respond to any outbreaks or diseases in the continent. We have Africa CDC, the headquarters here, as part of the African Union headquarters. We have 5 regional collaborating centers. The host agreement of the 5 regional collaborating centers is not yet being finalized. We have finalized with Gabon and with Zambia. Kenya is almost ready. We still have to go with ECOWAS and Egypt. We are working on the strengthening our public health systems in our member state, building the capacity, doing the needed training and capacity building to the health staff in our member states, supporting the surveillance and the information systems, supporting our laboratory systems in our member states. So the Africa CDC is fully implementing its 5-year strategic plan. We have responded to many outbreaks in the continent. Lassa fever, monkey fever, Chikungunya, Ebola, and Ebola, we maybe later Dr. John can give more details on what we did for the Ebola in the DRC, because this is one of the biggest outbreaks in the continent. For the coronavirus, the latest outbreak, also I will leave the details to Dr. John, but I can say that we did our best as African Union Commission, represented in the Africa CDC, with our partners, especially WHO and other health partners. We are trying our best to protect the continent. Immediately, we looked for funds. Bill and Melinda Gates stepped in. They have financed us with $5 million. Immediately, we recognized the gaps we have in Africa, that we knew that we have no capacity for the diagnostics. We have only one lab in South Africa, so we stepped in to fill in this gap by doing the necessary training to make sure that 15 member states will have the capacity to do the diagnostics if they get the right training, and this is what we did. Also, we had a training in Dakar last week. We bought test kits also for the testing, and we are giving priority to the countries that might be more at risk than others. We identified 15 countries, and part of these 15 is the countries which has direct airlines that goes to China. Till today, all the cases we have in Africa is suspected cases. There is no confirmed cases yet. But I will leave the details of the coronavirus disease to Dr. John. He will speak about the details later. In the health also, in 2019, we have a very important treaty that been signed last year. It's been adopted by the heads of states and government, which is Africa Medicine Agency Treaty. This treaty is very important because it is a treaty, if it's been signed and ratified by 15 member states, we can establish our Africa Medicine Agency. This agency is our regulatory body in Africa for the manufacturing of medicines. It's part of the implementation of our plan of action for manufacturing of medicines in the continent. This agency, it will be the agency that will work on building the capacity of our member states. It will be the agency that will harmonize the policies of the pharmaceutical industry. It also will make sure that it will regularize, it will protect the continent from being a dumping ground for falsified substandard medicines. It will encourage also more local production of medicines in Africa. By this afternoon, we have the country number 14 that they were ready to sign AMA. It is going very fast. We are very happy that member states realized very much the importance of this agency. So many countries signed yesterday and today. I believe by the end of this day we will have 14 signatories. We hope the ratifications, it will go as fast as the signatories that we had so far. This is the second important technical institution the African Union will establish because these institutions is part of building the capacity of our countries, is part of building the capacity of our public health systems, is part of putting direct interventions and supporting directly our member states at times of crises or outbreaks or any natural disasters. That's why these agencies are very important, Africa CDC and AMA. My third point is about moving out of health. It's social development. In social development, I can say the main achievement for Social Affairs Department is Social Agenda 2063. Social Agenda 2063 is a document that details the Agenda 2063 in the social sector. because we have our aspirations in Agenda 2063 that covers issues to do with social development, vulnerable groups, poverty alleviation. It's being covered, but to cover it into details and to give guidance to our member states on how they can provide social protection and social security for all the citizens of Africa is through adopting this document, and it has been approved by the SCC. It has been approved by the Executive Council. This document is a guide for our member states. We want member states to have aligned social agenda, because this social agenda, it is for the protection, for universal health coverage, for the rights of the person with disability, is for the protection of children. So it's really a very important document. With this social agenda, we have also adopted our 10 years plan of action for the eradication of child labor and human trafficking and modern day slavery. This also is a plan of action that we would like our member states to implement, because we know that there is very bad forms of child labor in some of our member states, and it's part of protecting our children in the continent is to make sure that they will grow up healthy mentally and physically by protecting them for any worse or harm type of labor. This year also, it marks 3 decades since we have Africa adopted the Charter for the welfare and the welfare of the child. This charter is also a charter that our member state is implementing. We have the Committee of Experts for the Right and Welfare of the Child following up on the implementation of the member states of the charter. We have a reporting system. We receive reports from our member states. But this year, we will be celebrating 30 years of the African Charter for the child and for the right and welfare of the child. And there is many activities. Maybe later Madam Sesi can put some details of the activities that the committee will run throughout the year as part of celebrating the advancement and the promotion of the child rights in Africa. Also, one of the issues I would like to touch on is in this field of sports. In 2019, we have managed to organize our African Games. It is an edition that happens every 4 years. It is the main sports activity that happens on the continental level, that led by the African Union Commission, by the Department of Social Affairs, and by our Sports Council in Yaoundé and the Division of Sports within the department. The African Games, it was organized, it was hosted in Morocco. It was a very successful edition. What is unique about the African Games 2019, it is a qualifier for the Olympic Games 2020. This is also one of the main activities that undergone or under the Social Affairs Department. I think, generally speaking, on the different sectors we are mandated with, we tried our best in the department to make sure that we will follow up on the implementation with our member states. We are on track with all our mandatory meetings. We had 3 SCCs during this year. We have 2 sessions of our SCC on migration and on labor and social development, and 1 on migration and refugees. In the migration, in 2019, we carried on with our tripartite task force on Libya. I can say that we have made a great success, because we have managed to take back from Libya, to repatriate 48,000 migrants to their countries of origin. This is a very big number. We did it with our partners, especially IOM, and also with the support of the government of Libya. We took these migrants to their countries of origin. There is around 5,000 refugees. Also, they have been resettled by UNHCR. And some of them, they are now in Rwanda, because also we have signed an MOU between the African Union, the government of Rwanda, and the UNHCR. Rwanda offered to host by refugees. For them, they have different options. They have the option of resettling in Rwanda, and they have the option also of being resettled in a third country. But we appreciate very much the offer from Rwanda, and there is also, before Rwanda, there is Niger also is hosting quite a number of the migrants that's coming from Libya. Issues to do with migration policies, we have our updated policy framework for migration. We are following up with our member state to make sure that they have national policies aligned with this continental policy. And also we have evaluated Ouagadougou +10 plan of action on human trafficking, and we are updating also this plan of action. So on migration, I think we are on track on implementing the policies we approved and adopted as African Union. And also I can say that there is more awareness in our member states. The biggest achievement we can congratulate ourselves on is the approval of the establishment of 3 centers for migration. By the end of this summit, we will have the structure and the statute approved by our heads of states and government. We will establish an observatory for migration in Morocco. We will establish the Center for Research and Survey in Mali. We will establish the Center for the operations and for combating human trafficking. It will be in Khartoum, Sudan. These 3 centers will be working under the Social Affairs Department, and they will be our new mechanism for research, for survey, for data collection, and it's part of the implementation of goal number 1 in the GCM, the Global Compact on Migration. It's part of filling the gaps we have in the statistics. Part of filling the gap, also we are producing our report on labor migration. We will have our 2nd edition. It's ready, and more than 35 member states, I believe, they participated in this report. I think I've tried to give highlights on some of the areas that's covered by social affairs. Maybe director can continue, and also if I forgot to mention some of the main achievement of 2019. And because I see Dr. Jane, she came in, she will not be happy if I don't mention the summit. In December, we had a very successful summit. It's a global summit on combating online sexual exploitation for children. This summit, it was attended by many countries around the world. It's the first time for this summit to be hosted in Africa. It's with We Protect Global Alliance, and also the government of UK. This summit is very important for cyber security issues, for also preventing and protecting our children from being exploited through the internet. And we know that they have accessibility, most of them at a very early age. So by OXI, the Online Sexual Exploitation Summit or project, I believe I will end here. Madam Sisi and Dr. John, they can cover the rest of the issues. And if there is any questions before I leave, I will be happy to answer. Thank you very much.
Thank you very much, Commissioner. As stated at the beginning, the Commissioner will have to leave. So we require the utmost of discipline in terms of asking your questions. Strictly 1 question per person. So please start with your most urgent question. If you have another question after that, we will come back for the 2nd round. Can we have a show of hands for those who have questions? If I ask you to ask your question, please tell us your name, the agency that you're coming from, and then your 1 question. I have questions on both my left and right. So let me do this. I will start with 1, 2, 3, 4. Let's start with those 4 questions, Commissioner,
Yes.
and then we'll come to the second round.
Thank you. Thank you. Ntakwana Ngatane, Eyewitness News. I'm just wondering why it is that in terms of the migration centers, you said you have one. Sounds like they're mostly in how come you don't have one in Southern Africa? Because, I mean, we've seen a lot of people moving towards, particularly South Africa. There's a lot of pressure in terms of welcoming migrants.
Thank you. I'm with the China Rage International. Talk about the purpose of the
Thank you. Gas Garusnasi from Shinwan News Agency. There's a great deal of alarm regarding the coronavirus all across the globe. My understanding is that has not been any confirmed case of the virus in the African continent. But anyhow, what steps are you taking to ensure that virus doesn't reach the African mainland, or at least African countries? And the virus, it's based, or at least it was first detected in China. So what kind of collaboration or coordination are you undertaking with Chinese authority regarding the battle against coronavirus?
Thank you. Samuel Gabriel with Bloomberg. My question is about Libya. Just sort of like for data, how many people are you expecting would be would return to their homes in 2020, and how many people are still stranded in Libya, and what's the financial requirement for this process?
Okay, thank you very much for the questions. Regarding the centers, the Morocco one is in North Africa, the Sudan one is East Africa, the Mali one is West Africa. For the southern region, we have just started last year working with the region to focus more on the issues to do on migration, and if need be in the future, if we need to have a center in the southern region, we will do it. For the time being, these 3 centers are continental centers. They will serve the whole continent. But if there is a need in the future, I think there is no problem of having a center for the southern region. The AMA, where and when? AMA, it will come into force when we have 15 ratifications. We have now signatories, 14, maybe by the end of the summit we'll have the 15, but we have to wait for the ratifications. 15 ratification. When it is ratified by 15 member states, then it will come into force, and then we can call for member states who are interested to host, because member states, they will compete on hosting AMA. So till now, it's not been decided because we need to wait for the 15 ratifications to be submitted to the legal council. On the coronavirus, as I said, there is no confirmed cases in the continent, but we are working on the prevention method. We are doing a lot of awareness to the African public on how to avoid this virus, and also we are working on the side of having laboratories for diagnostics. We are working also with our member state to make sure that if there is suspected cases, how to deal with it. And also we are working with the government of China, because government of China is also supporting Africa CDC. It is one of the main partners that China is supporting us. Yesterday, we have approved in the Executive Council a communique in support to the government of China. We have experts working with us here at the Africa CDC in the headquarters here, And also, we are seeking the attention of our member states by doing regular briefings. We have briefed the PRC 2 weeks ago. We have sent reports and information to member states. We have convened conference meetings, conference call meetings with the permanent secretaries of the ministries of health. Most of the member states participated. We have the emergency center that's working every day here at Africa CDC, and I will leave more details for Dr. John to be mentioned by him, but I think we are doing our maximum best as Africa CDC to support our member states and to protect the continent from this coronavirus. The third question is, I think, on Libya. On Libya, we will continue the repatriation of the migrants with IOM, with UNHCR. We will continue with the task force, because the task force mandate is being expanded and extended. And also financially, we depend to a large extent on the partners, especially IOM. There is also financial support from the European Union. There is also budgets from member states. But mainly it is IOM who is doing with us the job of returning the migrants. The last estimated number is around 6,000 to 7,000. They are still stranded, and we will work with the government of Libya to make sure that we take them back. But the problem with irregular migration is that we are taking migrants back, but there is new migrants coming in. So unless the message goes out to the young people in Africa, men and women, that don't take risky routes, don't risk your life trying to migrate. Look for legal corridors to migrate. Migration is a right, you can migrate, but we need to tell them, please don't be exploited by the human trafficking networks. Don't be used by them. Don't be fooled by them. Don't let them fool you with a false dream of migrating to Europe, looking for a green pasture. That's not going to happen. You will end up in a detention center in Libya, or at the bottom of the Mediterranean, or sometimes dead in the desert. So this is a message that we would like you to help us taking it out. We are working with the member states who have good experiences in this area to make sure that we will use their experiences. It will be shared with other member states, but really it is an issue that we will continue to deal with it, because there is human traffickers that are benefiting from this. There is an organized crime behind this, but also there is our young population in Africa who are looking for better life, and they are trying to get this better life abroad. We tell them that there is more opportunities in Africa, especially with the Africa CFTA, especially with our protocol on the free movement of people, right of residence, right of establishment. The barriers is now being lifted in many member states of Africa. We have visa on arrival arrangements. We have countries that they have, like the ECOWAS region, it's been lifted maybe 2 decades ago. So we are encouraging more mobility within the continent. We are encouraging more investment attracted from outside in the continent. We are trying to create more jobs in the continent, because the unemployment is one of the main reasons for these failed attempts of migrations. I think I have covered. Thank you.
Thank you very much, Commissioner. This time I'll start from this side and going this way. I have 1, 2, and then this way I have 1. Emmanuel.
I'm just struggling to understand. My name is Emmanuel from Africa. Across the world, we are seeing lots of countries with much robust healthcare systems imposing quarantines of entire cruise ships, travel advisories, yet we see the likes of Ethiopian Airlines still flying, still saying that there are no travel advisories that should be given from African countries to China. What is the logic behind this?
Robbie Corbulay with AFP. On testing for novel coronavirus, you said that 15 member states will have the capacity to do the diagnostics if they get the right training. How many member states currently have the ability to conduct these tests? And what is the timeline for getting testing kits and those capacities to all member states?
We have one here.
It's been asked. Yeah.
Is there another one? Is there another question? One hand there, please.
Yeah, my name is Peter Fabricius from Daily Maverick. You speaking, Commissioner, as though the presence of the CDC in Addis is a fait accompli, and I just wanted to check that is the case, because I have heard that there's some feeling that it's not been properly authorized, and that the Moroccans are actually bidding to host it, possibly with, so the rumor is, with U.S. financial backing. So I wondered if you could address that question.
Thank you.
I would. Sorry. Do we have any last question for the Commissioner? No.
I think I will need the help of Dr. John, but I will touch upon the 3 questions and I will leave the details to Dr. John. We are working very closely with the government of Ethiopia, and the director, Dr. John, had a visit to the airport with the Deputy Minister of Health of Ethiopia. They made sure that there is advisory at the airport, there is screens, and even here at the African Union building, there is 3 screens at the main gates, and also we are giving awareness around for the delegations. There is also help and support being given. There is an isolation room being ready, prepared, God forbidden if there is any case. So we are trying our best, but I will leave Dr. John to answer the question of who is this 15 member states that we are working with now, what is the criteria for choosing these 15 member states, what is the training needed, and I will leave the details to Dr. John. For the issue of the hosting of the headquarters of the Africa CDC, in the statute of the Africa CDC Article 6, it said that the headquarters of the Africa CDC is going to be hosted in the headquarters of the African Union, unless the Assembly decide otherwise. So this is Article 6. And there is Article 24 from the statute also. It talks about the establishment of the 5 regional centers. There is still a room for member states if they want to open the issue again. Legally speaking, they can open it, but it has the process has to go from the bottom of the procedure, which is to open this for all the 55 member states to apply and to show interest if they want to host the Africa CDC. But till today, and this is a decision made in 2016, the headquarters of Africa CDC is going to be hosted in the headquarters of the African Union, and that's what we are doing. We have an offer from the government of China to build the headquarters, and there is an agreement signed, and we have the designs are ready, the model is ready, the soil testing being done, even laying the cornerstone is all being done, but that doesn't mean that there is no room for opening this issue or this hosting issue again. Thank you very much.
AFP. Sorry, is your question answered?
No, John will answer.
Dr. John will answer.
All the questions for the coronavirus, Dr. John here, the director of Africa CDC, he will be giving you all the details. Yeah. Before leaving, I would like to thank all of you on behalf of Social Affairs Department. Thank you very much for coming to this press conference. We are ready to give you more information. We have our report for 2019 just being published, and we have this report for the press conference. Also, those who want hard copies, they will be offered to. Thank you very much again, and thank you to DIC for organizing this press conference. And my apologies, I have to go back to the meeting. Thank you very much.
Thank you very much to the Commissioner. She has to go back because the plenary is ongoing. It is a closed session, and she has some issues to attend to there. But joining us now will be Dr. John Nkengasong, who's been sitting with us for a while. There were a number of questions that came up regarding public health issues. So I'm just going to invite him to come and take a seat here so that he can take those questions. Okay, we welcome Dr. John to the press conference, or at least to the part where he's going to be answering some of your questions. I think you've heard the questions that have been put to the Commissioner, so we'll start with those before we take fresh questions for any of the participants here.
Thank you, Madam Wynne. And good evening or good afternoon, colleagues. And I see a lot of the familiar faces that we have been working together over the last couple of weeks as we struggle to prepare the continent for this coronavirus outbreak in China. So let me, first of all, respond to the preparedness part, and then just very quickly provide an update. The Africa CDC has established what we call the Africa Task Force for Coronavirus Preparedness and Response, which brings all member states twice a week, and we discuss issues of coordination, discuss issues of how to harness resources. It is through that task force that we now have a training that just concluded yesterday in Senegal with 15 countries on diagnostics. So hopefully, as of Monday, tomorrow, 15 countries will be able to confidently diagnose this virus. In addition to those 15 countries, there was already South Africa, Cameroon, Ghana, and Nigeria that were equipped with the ability to do accurate testing. We insist on accurate testing because there's no room for a misdiagnosis of this very important event happening, which is the coronavirus infection. So that is one part of the preparedness. The second thing to note with the preparedness is that the World Health Organization has already distributed test kits as of this week, has shipped test kits to so many countries. And we will be organizing a second training soon with 20 countries on the same test kits so that they can use them appropriately. The third and last thing about diagnostics is that China is going to has already shipped us 3,000 tests. They should be arriving either today or tomorrow. They probably have arrived. And we will store them and just keep them as backup in case they have any emergency needs there. So in terms of diagnostics, we are better prepared today than we were last week, and even more so than we were when we all gave you the briefing, when we met and gave you the briefing a few weeks ago. So that is one thing. Second is enhanced screening and surveillance. We have just conducted a training this week with Ethiopian Airlines, together with the National Public Health Institute of Ethiopia, to make sure that the airline is well equipped with managing any events and providing additional information. We'll expand that training to many more airlines and airports in Kenya next week on the 13th. So that, with us, in collaboration with the the Association of Airlines and Airports in Africa, in Kenya. So we are moving as fast as possible to prepare the continent for any eventual outbreaks there. So that's what we've done so far. I think with respect to the advisory, we are aligning our recommendations strictly with what the World Health Organization has advised. If you all recall, when they raised this issue to a public health event of international concern, they were very clear that there should be no restriction on movement of people, goods, and air travel. So what you see countries doing are individual decisions, which you cannot control. But I really want to say that for Africans who are returning, we have the obligation to receive our citizens and keep them for a while, monitor them, screen them, and then release them into the community. I say this because as of yesterday, we started receiving some reports that some countries are refusing their own citizens from coming back to the country. It cannot happen. I think we should all act collectively and make sure that we put pressure where it has to be placed so that Africans are not rejected. So I think those were the two the questions that you raised.
Okay. All right, we'll go for another round. Okay, this time I'll start with you on this side, and then the lady at the back, and then Sarah, and the gentleman here.
Thank you, Dr. John. Vincent from Radio France International. My question is, who are the countries that are refusing, which are refusing citizens?
Let's take a number, yeah. The one at the back? It's been asked, same question. All right, Sarah.
My name is Sarah. My name is Sarah Kimani from the South African Broadcasting Corporation. Tell us about the Chinese role in the Africa CDC that you say that an agreement has been signed. What exactly will it be? Is it just the structure that they're building? Are you also going to have them as researchers? Secondly, America has expressed concern that if you're going to be partnering with China, you must be very careful that maybe they would be stealing some of the information that you have. And they're also saying that they may actually pull out of supporting the CDC if you go ahead and make China one of your main partners.
My name is Ashok Bihari. I'm from Mauritius, the Mauritius Broadcasting Corporation. Could you tell us what are the 15 countries that are ready for accurate testing? And this is, but my main question is about the air links, the direct air links. But many countries have suspended their flights, the direct flights to China. But is there any stand from the CDC? What are the risks of maintaining air flights to China?
Okay, that's 3 questions. If we have one more, and remember that we have other specialists from different areas of social affairs. If you have questions around the whole briefing of the commissioner, that applies to other colleagues who are here. Do we have another question?
Thank you. Let me start with a question of the countries. I think when we asked, approach has been that we should really work collectively, and we count on the media a lot here to make sure that we spread facts and not fear. And if we promote fear and misinformation, it becomes very difficult to manage this. We are in a preparatory mode. We don't know what will happen tomorrow. We don't know what will happen next week in Africa when we move to a response phase. And I must say that in my 30 years as a virologist, I've seen people panic when there's an outbreak, and that creates a lot of problems. Yes. So I don't think we necessarily need to name names of countries that this is a general statement that countries that have that attitude should know that it's not in conformity with what we will recommend. I think that is one. With respect to China's role, as the commissioner very clearly stated, we have an agreement with China. China has committed $80 million to the construction of the headquarters of Africa CDC. We have been working with them in a very collaborative manner. And needless to repeat what the commissioner has said. In terms of the comments from the Financial Times report that you read a few days ago, I think that engages them. We don't know that we are dealing with any suspicion. I think we believe that our relationship is trusting. We also believe that the Africa CDC is not a bilateral partnership with China that is very open to all partnerships there. Can name you some partnerships that we have. I mean, the US CDC has been working with the China CDC over the years, since 2005, discussing ways to work together and actually working together towards this. So I think the Financial Times report must be put in the right context. Secondly is that the Public Health England have staff seconded with us. The Gates Foundation is supporting us tremendously. Many countries, Japan is planning to second people. So the impression that this is a relationship with China and Africa CDC must be dispelled at this moment. It's open for more partnerships there. So with respect to the airline advisory, I think we continue to insist that we use a coordinated approach to address this epidemic, because the World Health Organization has stated clearly that there should be no restriction in flights in and out of China, and our recommendation will adhere strictly to that recommendation from the WHO.
Okay, any further questions? Emmanuel.
You just mentioned about the response strategy, because now you're just in the preparation. Many believe that it's only a matter of time before the virus is confirmed here. What is that strategy? And in terms of information sharing, we saw the case of, example, Tanzania, which refused to share details about the Ebola case in that country. How do you deal with that? How do you enforce info sharing?
No, thank you. I've explained the preparatory strategy, hopefully clearly. Our response strategy is rapid dictation, rapid containment, which means we don't have, if you see what is going on in China, it's pretty scary. And as of today, we had 37,000 cases with 811 cases, individuals dead. So we've passed the number of deaths that occurred in 2002 when SARS, a similar virus, hit China and the world, because this has spread. And at that time, there were about 770-something deaths there. So we've passed that level here. Now, our strategy, we don't have the means that China has. I mean, to build a big a 2,000-bed hospital in 1 week or 2 weeks. So our only response strategy is our ability and capabilities to detect early and respond early. I think there's a silver lining in this, that we've been observing this as a continent since December and January, and now we are in February. So all member states are alert. It's fair to say that all member states have developed an action plan to respond. And if there's a case, I have no doubt that they will be able to capture it quickly with the diagnostics that are now available and respond rapidly. Next week, by the end of next Friday, we shall have 40 rapid responders here in Addis Ababa on standby. So, and we've mapped out scenarios of different categories of countries, what we call a scenario planning, where if the virus hits a country that has very, very weak systems, what do we do? If it hits a country that has more advanced capabilities, what do we do? And our 40 rapid responders had been trained already on multiple times by us waiting for such a day. So they are like your rapid reactionary force. They will be here, and in case a country detects any infections and call us in, we should be able to be there within 24 hours.
Are there countries that are on more red alert than others in your time? Like, you're more worried about this country than this one?
I think, very simply put, it will be along the same lines of the strengths of our health systems on the continent. Some countries, you know, are stronger in terms of their health system in Africa than others. I mean, others are going through challenges, and we all know those. And you don't fix those things overnight. So we keep our fingers crossed that any new cases do not start in those very fragile countries.
Okay, thank you. Is it still on the public health? Can you speak into the microphone for interpretation?
Whether they're going to equip it later or they just do the general construction. I think
Yes, it's construction, and the agreement is for construction and equipment. Say that again. $80 million is what has been committed.
All right. Thank you very much, Dr. John. The director would like to make a few additions to the work that the department is doing. So I will just invite her to come to this chair so that she can make that update.
Go ahead.
Yes, please.
Thank you. We need just to add that our department is also in charge of culture. As you know, our head of state have adopted the African Cultural Renaissance Charter, which we are working now to have 15 ratification so it can come into force. And then we just had today a side event on the World Heritage Fund, and then our champion on charter on culture, which is Ibrahim Boubacar Keita, the president of Mali, so was leading the side event today, and then we are going to work with him to have a plan of action on culture. I would like also to add that our department is also in charge of vulnerable group, elderly, and then disability. Last year, so our head of state have adopted the protocol on aging and then the protocol on disability. So we are also trying to get the ratification so then these two protocol can come into force. So this is what I would like to add. So thank you very much.
Okay. Do we have any questions regarding that update? No. All right, so it then falls on me to thank you very much. This has been very well subscribed, and so we are looking forward to seeing a lot of coverage on this issue. Before you go, colleagues, maybe if I can just request you to use the right words when you're talking about the Africa CDC. It is the Africa CDC, not CDC. CDC is in the United States. So we really want to be able to promote this and brand it as the Africa CDC. That means that it will then have a life of its own outside of other CDCs. So I count on you for that support. Thank you so much again. All right.
French, I cannot say that. I specify Africa.
Please.
I cannot say Africa CDC.
Oh, really? Okay. Thank you. Interpreters, thank you so much for facilitating this. Thank you. We really appreciate.